In this video, I'm going to explain how Medicare covers your dental needs. Stay tuned for a very frustrating video. Medicare doesn't cover dental. So people assume it does because especially if you had group insurance through your employer all these years, most group plans had some dental. Some were terrible, but a lot of them had dental. And the bigger the employer you had, the more likely it was that you had some dental and sometimes very, very generous dental. So you come into Medicare, you're turning 65 or you're retiring after age 65, and you're assuming, wrongly, that you're going to have similar benefits to what you had at your employer. And then you find out you don't. You don't have any dental. And you ask me, are you sure there's nothing? I'm sure. There's no dental. If you have original Medicare, it will not cover any of your teeth. But what about if I need dentures? They're really expensive. Or a crown, or an implant, root canal. Nothing. Nothing gonna cover it. Okay, you could buy a Medicare Advantage plan, and it's becoming very popular to have some dental in Medicare Advantage. And this year, we've seen a great expansion of those benefits. Now, that's not to say that every plan in every state has dental, but it's become very, very popular to have some level of dental. And almost all plans have where you could pay a little extra to get some basic dental, and you could pay kind of a lot extra to have a pretty good dental plan. And you have to stay within a network, and you have deductibles and copays, but you had some dental that resembled what you had when you were working. But as far as a Medicare supplement, which is still what most people buy and have, there's no dental in original Medicare, and there's no dental in your supplemental plan. You have to buy a separate dental plan. We'll say it costs around $40 a month. Then you'd have a deductible, probably around $100 a month deductible, and then it's going to pay a percentage of your claim. And there's going to be limits. It's going to pay so much a year. So you're like, well, that's not great, and that's not as good as I had at my employer, and that's what we're looking at. So if you haven't retired yet, a lot of people are watching my videos trying to figure out how this is going to look when they retire. Factor that in, that if you want a dental plan, it's going to be around $40. And it'll have a network. Most of them have a network. You have to go to those doctors, and then we'll have a deductible, and then it'll only pay a certain amount. And tell us what you're looking for and where you live, and we can give you a ballpark. We can run you a comparison quote of all the dental plans that are available, kind of talk about the pros and cons and see if you can afford them and if it's a good purchase for you. I don't like to push insurance and make people insurance poor, so I think people are really shocked when I say I wouldn't recommend you purchasing this. They're like, what? Isn't that your job to sell it? No, my job is to try to, get you in the right position. Sometimes that means trying to sell you insurance. Sometimes that's saying, just save the $40 a month, put it in your pocket, and if something happens in a couple of years, you have some money that you save because you're not going to be happy on dental insurance. So, if you're interested in a quote on dental insurance in your area, let us know where you live, what age you are, and we can show you what's available. Thanks.